Hello, this is Dr. Thomas Parisi, and today I'm going to be talking about chronic venous disease and current treatments. Chronic venous disease is a medical condition if there are symptoms involved. So if you simply just see veins that you don't like, that is considered to be cosmetic and is not covered by insurances. However, SEEP classification will let you know if this is a condition that will be covered by insurances. SEEP classes 3 through 6 have a new designation called chronic venous insufficiency. As you can see on the slide, things such as pain, skin discoloration, or ulcerations are not cosmetic. These are medical conditions that affect the activities of daily living and something that your insurance will cover. In chronic venous disease, the valves of the vein have become damaged or disease resulting in failure. This also occurs with vein dilation as well, so it is usually a combination of the two. Reflux reflects that the flow of the blood is not going in the proper direction and is backflowing more towards your legs, causing a pooling of the blood, which leads to increasing pressure. This increasing pressure can cause pain, swelling, cramping, restlessness, and over time can develop skin discoloration, dry skin, as well as ulcerations. And in some people, the veins do not go right to the bottom of the foot. They go into side branches and cause very large varicosities that poke out of their skin. The superficial veins we will be discussing today are the great saphenous vein, the small saphenous vein, and incompetent perforator veins. There are other superficial veins which cause reflux, however these are the main three. This short animation will give you a brief insight as to how venous reflux develops. Again, it is generally a condition of natural wear and tear and not due to any pathological process. Essentially, it is normal wear and tear of the veins. The analogy I like to use is the same as gray hair and wrinkles. It's nothing you've done wrong in life, it's actually what you've done right. So how do we fix reflux disease? Well, we use a disposable catheter which is inserted into the vein. We heat the lining of the vein, which then causes it to collapse or to have the collagen expand and fill in the vein. Now the catheter itself has to be positioned correctly within the superficial vein. And that is why we look for this called the sacral-femoral junction. It does have an animated character appearance, and what we do is once we see Mickey Mouse or Minnie Mouse, we rotate the probe head 90 degrees and measure approximately 2 to 3 centimeters to know that is where the tip of the catheter should lie. By doing so, we know that we will not cause any damage to the femoral vein, as well as any other surrounding vessels. This is how the procedure is done. First, a numbing shot is done around the knee to thigh area, depending on the location of the vein. Once numb, an IV is started into the vein. The catheter used is so small that it fits into the IV into the vein. Now there are no nerves inside veins, so you shouldn't feel any of this. The catheter is then advanced up the vein until it reaches the sacral-femoral junction. From there, it is measured 2 to 3 centimeters from the junction to make sure that we are not too close to the femoral vein. From there, additional numbing medicine, called tumescent, is placed around the vein to make sure that everything is safe during the procedure. This will catch any heat that escapes the vein during the closure to make sure that no additional surrounding tissues are heated when they shouldn't be. The catheter is then moved down the vein towards the IV site, closing the vein. Once closed, everything is removed from the vein so there is nothing left within your leg. Pieces of sterile tape, called steri-strips, are placed over any injected areas, and then a compression sock is applied that should be worn for 3 days. Post-procedure, you should generally walk 30 minutes a day, ice as much as you can, and elevate the limb as often as possible. By doing so, you will obtain the best result possible, and we will see you 3 days later. Here's a picture of a pre- and post-treated vein. The diagram on the left shows a pre-treated vein, and if you were to press on that area with the ultrasound probe, it would easily open and close. Whereas if you look in the figure on the right, you will see that material within the vein. That could rather be expanded collagen or a glue-like product, depending on the procedure that was done. Also, with the picture on the right, you will not be able to compress the vein, thus you will see that the vein is closed. And that is the general overview of this procedure. I hope you found this video informative, and we'll see you soon.